name is Dr. Jim Powell, chiropractor here in Canton, Ohio.
And I'm Dr. Chip Null, also a chiropractor here in Canton.
We'd like to welcome you to Before the Scalpel. We have a unique program here at Powell Chiropractic Clinic, the only clinic in the United States with this exact program, and we have a 90% success rate.
And we call it spinal decompression therapy, also known as the Discovery Program here at Powell. Welcome.
Welcome. Welcome back to Before the Scalpel. The topic of today is when a patient hears the statement that they're going to require surgery for their condition. The moment that they hear that, that's what changes in their head. They feel destined for a problem.
And for most folks, that's devastating news. To hear that you need surgery, life-changing or life-ending in some people's perspectives. So we get a lot of those here, referrals from other patients that have heard the same thing,
right,
and then had hope by coming here.
Right, and they always have a family member or a friend that have had surgery.
Yes.
That some of them do well, but a larger percentage of them don't. Even Tiger Woods has had multiple back surgeries. It wasn't because of a lack of money,
right,
or a lack of talent in surgeons.
Right.
It's because surgery begets surgery.
Absolutely.
And that's an unfortunate truth that some people have to do, but you try to do everything else first.
I agree, and it's one of those things with conservative options like chiropractic. Having surgery, you can never go back from.
Correct.
Once the process is done, you can't change it. Going through chiropractic care and some of the things that we're going to talk about today with Discovery and spinal decompression, always an option to try, and if it doesn't work, you at least try it, and then maybe you do need surgery. And if you do, most of the time you're going to recover much better than those that didn't have the conservative care that we offer here.
Correct.
Yeah.
And we've had the privilege of being in practice here at Powell for 55 years.
Amen.
And so we've had the opportunity to meet surgeons. And so if one of the patients that comes here, and we'll talk about that in a later episode, if there's nothing that can be done, we have the guys that we trust, that we would send our friends and family to.
Absolutely.
And even those guys have said to us, there's no eraser on a scalpel.
That's right.
Once performed, it cannot be undone.
Well, and as we alluded to, I believe in one of the earlier episodes, we had a surgeon come see our decompression machine and commented on how it was a great option for those that potentially need surgery but maybe could benefit from what we have.
Right.
And I forget what he said to you. You commented on what his quote was.
He said specifically, if patients came here and used all that you have, they wouldn't need him, which I took that as a very high compliment.
Absolutely.
So.
Absolutely, amen. Yeah. So part of what patients come with, how do we know they don't need surgery, or how do we know there's other options that they could benefit from? One of those being an MRI.
Right.
Which is an image of the spine that shows the disc specifically, and then gives us a better idea of if we can help or not.
Correct. An MRI has tremendous value. I've said this before, I'm going to say it again. If I took both of my arms and put it in an MRI unit, the anatomy of the arms is what the radiologist gets to see or the surgeon gets to see. Bone, ligament, muscle, tendon. And then in the spine, disc, spinal cord. But it does not show function.
Correct.
So if I put both of my arms in an MRI, I can get a nice report from the radiologist, but he couldn't tell you which arm was paralyzed. He can only tell you the anatomy.
That's right.
So with doing this for 20 plus years, since 2006, we have seen enough cases that when we do exam findings, all of our analysis, we have a pretty good predictor whether this would be of value for the patient, our program, or if they should consider surgery.
Absolutely. Well, and to go off that, we also x-ray, which for chiropractors, that's really our blueprint. Looking at patients, looking at their structural balance many times is an issue, and that's one of the reasons why they have the disc problem.
Correct.
And so we combine our radiological evaluation to determine how are we going to adjust these folks.
Correct.
And how specific we can be with the instrumentation we have and the different techniques. And you and I, although we do a lot of things very similar, we also have very specialized techniques that we use.
Yes.
And so we complement each other very well.
Right.
And sometimes what I can do may not be what the patient needs, and I can send to you and you can help out. And so we coexist great.
It's a unique environment. Not all chiropractors have the opportunity to have another chiropractor in their clinic, and then one that complements where, let's say, my gifts are limited in this particular area, you happen to shine, and vice versa, which is so unique that God put us not only in the same family, but in the same practice.
Absolutely, absolutely.
One of the things that I hear patients say when they're told you have to have surgery, they don't get an easy feeling inside.
Right.
That small, still voice that talks to them, they have a red flag, and they're like, wait a minute, hold the phone. What else can I do? Absolutely. And I hear that so much. I know you do as well.
Oh, and I think what happens with patients nowadays is with technology, they'll go on the internet. When they're told they need surgery, they'll actually go on and watch these surgeries because you can do that.
Yeah.
And they see that and they realize, I don't want to do that.
Right.
I want to do anything but that. So, their friend says, well, go see Dr. Powell or Dr. Null. They'll do an evaluation on you and they'll tell you if they can help or not.
Right.
I mean, it's scary. It's almost the same as getting a terminal diagnosis, because you have patients that get surgery and sometimes they lose their function, they can't walk, they lose strength, they're in a wheelchair. I mean, how terrible is that?
Right.
So thinking about an adjustment and a successful decompression program that's highly specialized, and you mentioned 20 years of practice and how we've developed this, it's a game changer.
Really is.
Yeah.
And the testimonial of a patient that you will hear shortly, Donald, he was told he had no other option. And in his particular case, his goal, which is a very unique goal, his goal was to be able to stand at the altar with his bride. And he knew he could not stand at the altar for the wedding ceremony because he couldn't stand for that length of time.
Wow.
I ended up getting severe sciatic nerve pain in December of 2024, and it got to the point where I couldn't even drive a mile or two without having to get out of the car. I had to stretch my legs and stretch my muscles, and something was severely wrong, and I was right. After meeting with Dr. Jim in 2024, I ended up taking decompression times on the table. I was at twice a week to try to relieve that pain on my disc. So after x-rays, and then specifically Dr. Jim fought for me to get an MRI with insurance, and it had been a few years since I talked to a back specialist, and it had gotten worse. My back I have degenerative disc disease at L3, L4, and L5. The ultimate goal now is to get to the altar, as I am engaged. And so after speaking with specifically Dr. Jim here at Powell Chiropractic, I just want to be able to stand at the altar for 30 minutes. And that's, he's allowed me to do that. They've been super welcoming, the whole staff, greeting me as I come in every day. And then the work being able to be done on my back has been very much helpful and progressing and helping me live hopefully a longer life, but just to walk longer is great.
So his goal, which he just got married last week,
Was able to do it.
And he was able to stand, and he came to me.
Yeah.
He said, I would not have been able to stand at the altar to marry my bride if it wasn't for this office and this program, which
awesome.
just gives me such a wonderful reward.
Well, that's why we do what we do.
Yeah.
Those are the rewards we get. And we just like to be able to help everybody and get the word out. And those small things are huge in the eyes of people that, those are things you and I take advantage of, take for granted, I should say, just because we do them all the time without thinking about it.
Yeah.
So, those functional limitations, we call it, what's the goal here for you? What do you want to be able to do? That's the thing we focus on.
Right.
88%, 90%, 95% of the time,
Yeah.
we can achieve that. So,
What's kind of bad sometimes is that we take our success for granted because so
Absolutely.
many people have the ability to reach the goals that they have set
yes,
that it becomes expected.
correct.
And to the point where sometimes we don't even properly celebrate the victory because
Yeah.
it's so common here
Right.
that the patient's just going crazy and we're
Yeah.
like, oh, that's great.
Yeah, yeah.
So,
Happens
but,
all the time.
but we do this all the time, and which is so unique that we have this opportunity.
Yeah.
It's the combination, I believe.
I do believe so too.
Yeah.
We have a very unique system that works.
Yep,
So between adjustments and strengthening,
yep,
we have the laser, as we had mentioned in previous episodes, nutritional support, and then the fact that we're coaches of this, as chiropractors, which means doctor means teacher.
Yeah.
We also coach our patients because it requires a lot of encouragement, because folks get better, but then sometimes they go backwards a little bit, and there's lots of reasons for that, but that's what we're here for.
Yeah, it's those lifestyle changes that have to be implemented.
Yeah.
And some folks can be a runner without compromising their back.
Yeah.
But the larger percentage do compromise their spine. And so the person that goes through the program that is an intensive long distance runner
Yeah.
may have to find a new hobby or exercise program to not bring it back.
Right.
So that constant impact very well could be very negative for that particular case. And we do that on an individual case-by-case basis.
Absolutely. Well, and knowing that they can't run, especially if it's something they're very passionate about and love, that's tough on them emotionally. But when we get the physical aspects better, structurally, and with helping to heal that disc, we can transition them into other things, riding bikes, walking. I mean, there's a lot of benefits to that. And so that's where the coaching comes in,
Right.
really. So,
And sometimes patients are so stubborn, just like us,
oh yeah,
they want to run or they want to do that activity. So we modify, we make sure that they have the proper orthotics and the proper tennis shoes, and
That's
they
right.
don't run on asphalt and concrete, they run on dirt. And so there's variables that we can do. Decrease the distance, do sprints and walk, and sprints
Yeah.
and walk versus continued runs. So we have modifications
Yes.
for the one that's just so set on doing that particular activity.
right.
We do our very best to modify.
Yeah, well, an excellent point, because had they had surgery, they would have certainly never ran again. If they were
Correct.
structurally better, they can go ahead and run again, and we can help them get back if they so choose to do those things. So it's part of life.
In the surgery component, we explain this to patients very, very often. If the front end of the car is out of alignment, it could be just the front end. It could be how the tires were balanced or not,
Sure.
but it also could be the frame. So if the frame of the car is bent, there's only so much you can do to the tires.
Right.
So when they do the surgery, and especially some of the fusions that they have to do, you've now altered the biomechanics of the spine,
Right.
something that they will have lifelong.
Right.
So, and some folks unfortunately have to have that.
Yes.
But we've had such a great success, 90% from what we've seen at the clinic since 2006. So only really 1 out of 10 don't get what they came for, which is a pretty good
That's an awesome
percentage.
statistic. And anything
Yeah.
you look at, and I think too that patients that have had surgery, we can still see them here, even if they've had a fusion.
correct.
And when we say fusion, they use metal and screws to stabilize a spinal segment. And when they do that, it's not moving.
Correct.
But the areas above and below, as we know, but not everybody else knows, they continue to move, and then they'll wear down faster.
Right.
So then they're going to be more prone to structural problems, more back pain. And so chiropractic can help manage the alignment of those areas that are overused. And we're still able to help them. And I can't tell you how many times we've had patients come here after surgery that said, I really wish I would have came here first,
Correct.
because I could have maybe avoided this altogether. And so that's who we're trying to reach.
Right. So in billing, there is a code, a diagnosis code that describes the cause or the problem that the insurance company would reimburse for. One of the codes in the ICD-10 network is failed lumbar spine surgery, is an actual diagnosis code. So it's happened so often that they fuse the area of concern, and within 5 years, the disc above or the disc below is the next one to go. And then the surgeon's idea is, well, we fused the bottom two, we'll just go after the next two, which maybe that handles the symptoms, the pain and the problem that the patient's experiencing, but then within a short period of time, usually less than 5 years, the disc above that one goes.
Yep.
And so sometimes we're able to do care on that disc, even though they've had the fusion, that gets them to a place where their symptoms are reduced and they don't have to do additional surgery. It's something that they're going to want to maintain care for, which we provide here.
Well, and something else to consider. When you go to a surgeon, that's what they're going to recommend. That's what they know, and it's no fault of theirs in many cases. That's what they believe is going to help the patient.
Correct.
And I admire that, and I think it's fine. But when we look at them, as we were talking about with our extensive exam, a lot of times we'll find, well, there are alternatives. Sometimes there's not, but a high percentage of the time there is. So that's why, try this first.
Yeah.
Try this first. And if we can get a hold of these folks and let them know there's other options,
right.
That's the goal here. And so.
One of the unique aspects is what we found. I've been in practice for a little over 30 years. This stuff works or doesn't work.
Yes.
Doesn't cause harm.
Right.
So if they do everything that we have to offer and it doesn't improve, they can always have the surgery if they've tried everything.
Absolutely.
That would be the goal. I've had many surgeons say to patients, try absolutely everything else that you can prior to surgery.
Absolutely. Absolutely. Yeah. And again, that's what we're looking for. And so I'm glad we're here.
Very good.
Yeah. Absolutely.
So I'd like to introduce our next topic, which will be our next episode.
Yes.
The pain that no one could see.
Absolutely.
And we look forward to having the opportunity to share that information with you then.
Until episode 4.
Thank you.
Powell Chiropractic Clinic introduces Discovery, the alternative to back surgery. The advanced Discovery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.